Hospitalizations have risen across the valley. At Eisenhower Health, there are about 50 patients hospitalized with COVID. 43 are at Desert Regional and 13 at JFK Memorial Hospital. It's led to worker shortages at some hospitals, among other problems. I spoke with Desert Regional's Chief Operating Officer Mike DeToro about all this and more. Mike, first off, how are things overall at the hospital right now?
Doing well at the hospital right now. It's our busy season. We're seeing a high census right now. Our COVID numbers that we have for the Desert Care Network, we have 79 positive patients. Specifically at Desert, that regional, that would be 43. We have 13 at JFK and we have 14 at High Desert.
If you could put that in perspective for us, Mike, how big of a jump is that compared to just a month ago, and how concerning is this?
About a month ago, we were hovering anywhere from 20 to 25 patients, and that was pretty steady for several months worth. So we are close to, and when I say the 20 to 25, that was specifically for Desert Regional. So we are about double from where we were a month ago.
About double, and I'm assuming this is because the highly contagious Omicron variant.
That's what we expect. As we've said before, we don't test for that at the facility. That's done, the genetic sequencing is done at the county and the state labs. We do suspect, similar to the rest of the country, that Omicron is largely driving that increase.
Are you concerned that the numbers will continue to go up?
Well, if we look at our trending, we have seen the numbers climb, so we're preparing that the numbers will continue to increase. Our testing positivity rates for the few days we've had in January, we're at over 25%, which is up from 11.9% in November and about 7.5%, or 7.5% in November, it's about 11.9% in December.
What has been the impact on the hospital? I know, for example, we keep hearing from folks saying that there have been higher than usual wait times in the emergency room. What are you seeing, and what are the wait times to get in the ER?
You know, we do our best to triage patients that come into the ER. So we certainly take the most acutely ill patients back as soon as we possibly can. And when the overall hospital census is high at the hospital, we can see longer wait times than we'd like. So we do our best to mitigate that, get the sickest patients in, and really work to care for patients as best we can.
Are you also seeing a blood shortage right now?
Nationally and locally, there is a serious blood shortage. We are experiencing that. We have many conservation strategies in place to make sure that our patients that need blood the most are able to get it. But there is a blood shortage, and we want the community to know that they can work with LifeStream, which is a local blood bank, to donate blood. There's the ability to donate blood for the general community or even specific loved ones that may need it. You can contact LifeStream if you're interested in doing that. We certainly are asking for the community to help.
And also, is there any type of staffing shortage?
You know, healthcare workers were no different than the rest of the community. We get sick as well. We have seen a high number of call-offs these past couple months. So we are experiencing shortages in workers. We are doing many things to incentivize our staff. We're bringing in contract labor. We have overtime that's offered. We're even doing some very generous shift bonuses in certain direct care groups to make sure that we have the workers to care for our patients and to keep the patients safe.
You know, I can't imagine, Mike, how difficult this must be for a lot of the medical workers, considering this must feel like deja vu for a lot of them.
It feels like it hasn't stopped for a couple of years because it hasn't. So, you know, there is definitely fatigue, and every day I continue to be amazed by the selfless acts of our healthcare workers who put others before themselves and come into work every day for this passion that they have to care for our community.
Anything else, Mike, you'd like to say before we let you go?
Just, you know, I like to reiterate for the community, when we look at our patients that are in the hospital with COVID, still the large majority are unvaccinated. And for those that are vaccinated, uh, very, very few have been boosted. And we really need to start looking at getting the booster as being the new line of thinking, that you're not fully vaccinated until you get that booster dose. So we would certainly like to encourage the community to get their boosters if they're eligible, if they're 6 months out from the first 2 doses.
All right, Mike, as always, we appreciate your time. Thanks so much for joining us.
All right, thanks, Peter.